And I thought, okay, Idaho, because Cayman was going to school
for your board members, we've got Cassie, Denise, Shannon.
Okay, we ready, Pam?
Give me 1 second, I just put this in.
Okay.
And record on Zoom as well.
Recording in progress.
Okay, this is Mayor Ken Tedford. I'd like to call this meeting of the Central Nevada Health District to order. If we'd all stand and pledge allegiance to the flag.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Pam, if you could take roll, please.
Mayor Ken Tedford,
Here.
Vice Chair Cassie Hall,
I'm here.
Jim Barbie,
Present.
Shannon Ernst,
Present.
Justin Heath,
Here.
Bob Erickson,
I'm here.
Denise Ferguson,
Here.
Tyson McBride,
Here.
Larry Rackley,
Here.
Rich McKay, Jeb Rowley.
Okay, thank you. We'll go on to public comment, which must be general in nature, not relative to any item on the agenda today. Discussion can be held, but no decision can be made. Is there any public comment? Being none, we'll go to item 5. Has the agenda been posted in compliance with NRS?
Pam Moore, for the record, the agenda was posted on August 4th between the hours of 9 and 11 at the locations listed on the agenda in accordance with statutes.
Thank you. We'll go to item 6, consideration and possible action and approval of agenda is submitted.
Move
or
to approve.
revised.
Sorry. Move to approve the agenda.
Second it.
We have a motion and a second. All in favor?
Aye.
Aye.
None opposed. Motion carries to approve the agenda. We'll go to item 7. We have 3 minutes on here, May 30th, June 8th, and June 29th of the Central Nevada Health District Board to be approved. Are there any corrections or additions to any of those minutes? I'd entertain a motion to approve the minutes of May 30th, 2023, June 8th, 2023, and June 29th, 2023.
I move to approve the minutes from May 30th, June 8th, and June 29th.
I'll second.
We have a motion and a second. All in favor?
Aye.
Aye.
None opposed? The motion carries. We'll go to item 8 on the agenda. 8A, give me just a second here. 8A is consideration and possible action concerning approval of the, consideration and possible action on ratification between Central Nevada Health District and Immunized Nevada Memorandum of Agreement for Partnership. Darren, are you handling that?
Yes, thank you.
Darren Winkleman will handle that for us this morning, or this afternoon. Thank you.
Mr. Chairman, members of the board, for the record, Darren Winkleman filling in for Mr. Cage, who thought he should go to Israel rather than be at this meeting, so we'll maybe give him a little break for that. But the agreement before you creates a formal partnership with the district and Immunized Nevada to deliver back-to-school child immunization services and other events to help support immunizations within our district. CNHD will provide the vaccines and providers, and Immunize Nevada will provide the logistical support. Right now, Immunize Nevada has listed our events on their website, which so far includes August 12th in Hawthorne, Back to School Community Resource Fair, on August 16th, the Lovelock Back to School Vaccine Clinic. This agreement, as far as I understand, is a no-cost agreement. So with that, I'll turn it back to you.
Are there any questions of the board for Darren on this agreement? If not, I'd entertain a motion to approve this.
Mr. Chairman, Jim Barbie for the record. I move to approve the ratification of the agreement between Central Nevada Health District and Immunize Nevada for a partnership to provide immunization services at special events in the region.
Second it.
We have a motion and we have a second. All in favor?
Aye.
Aye.
None opposed? Motion carries and this agreement has been adopted. We'll go to item 8B, consideration and possible action concerning the approval of a signature page to be added to the Central Nevada Health District bylaws. Mr. Weed.
Thank you, Mr. Chair and members of the board. This should be a pretty short agenda item here. Back on December 8th, 2022, this board approved the bylaws. There were some questions as to the, I guess, authenticity of those. I believe our Miss Ernst was doing some things on behalf of the health district, and so we decided to include this certificate of the chair that would essentially say, hey, these were passed back in December. These are the bylaws of this board and of the Central Nevada Health District. And so it's before this board for a motion to approve the certificate and allow the chair to sign that, authorizing that these are the bylaws.
Any questions of Mr. Weed on this item? If not, I entertain a motion to approve this.
I move to approve
I
the
so
addition.
move.
Oh,
Sorry. I'll
That's okay.
second. This is Kathy.
We have a motion from Cassie. Do we have a second?
second it.
We have a second from Dr. Heath. All in favor?
Aye.
Aye.
None opposed? Motion carries, and we've approved that signature page. Thank you. We'll go to item 8C, consideration and possible action to concerning the approval of a HIPAA Business Associate and addendum relating to use and disclosure of public health information in association with the Unite US software previously approved by the Central Nevada Health District Board of Health. Mr. Weed.
Thank you. Jeff Weed from the Churchill County District Attorney's Office. This addendum to the previous agreement regards private health information. This board previously approved back in June 30th, 2023, to utilize Unite Us platform, which provides proprietary software to coordinate electronic referrals and case management. And so that was approved. HIPAA rules generally require that covered entities like the health district and business associates enter into contracts to ensure that the business associate which is Unite Us in this case, will appropriately safeguard that public health information. So this is the addendum to that agreement that provides, I guess, the regulations and details as to how they're going to protect that information. And so it's before the board for approval of the addendum. Again, that agreement was previously approved, and this is just in addition to that.
So here we're approving the addendum, right? The agreement's already been approved.
That's correct.
So I think the motion that we make, it needs to be the subject title, not the recommended board action below on your agenda packet, because we've already approved the agreement. The subject title includes the addendum, which is what we're approving. So I think that's where the motion should be, is if you would use the subject title as your motion. And I'd accept that as a motion to approve.
Mr. Chairman, Jim Barbie, I would move to approval of the HIPAA Business Associate Addendum relating to the use and disclosure of public health information in the association with the United US software previously approved by the Central Nevada Health District Board of Health.
Do we have a second?
Bob Erickson, I'll second the motion.
We have a motion and a second. All in favor?
Aye.
None opposed? Motion carries. We'll go to item 9A. Consideration and possible action concerning ratification of agreement between Central Nevada Health District and Nevada State Immunization Program for core immunization funding FY24 in the amount of $100,666. Shannon, do you have that?
Yes, that'll be fine, Mr. Chair. So for the record, Shannon Ernst, Churchill County Social Services. As you know, we have submitted several grants on behalf of the Central Nevada Health District to carry out services. One is for the core immunization to child across the region. So this has been awarded $100,066, and this goes back to July 1. So this would be a ratification of that agreement. The funds will provide for personnel, travel, some additional operating supplies, and indirect. And if there's any questions, I can answer for you.
Are there any questions for Shannon? On this one, I think the motion should once again be the subject title because Shannon said this is for core immunization, and that's not lacking in the recommended board action that's written there. So I think the motion should be the subject title.
Mr. Chairman, Jim Barbie for the record. I move ratification of agreement between Central Nevada Health District and the Nevada State Immunization Program for core immunization funding FY24 in the amount of $100,666.
Do we have a second?
Trustee Hall, I'll second.
We have a motion and a second. All in favor?
Aye.
None opposed, the motion carries. Thank you, Shannon. We'll go to item 10A, under old business, consideration and possible action concerning the approval of revised Central Nevada Health District organizational chart. Darren?
Certainly, thank you, Mr. Chairman, members of the board. For the record, Darren Winkleman. As we implement the district, we're finding that we need to make some revisions to meet the needs of the organization to support our overall staffing structure. The proposed structure more aligns with the different programs being implemented through the grants that are being awarded to us. Those proposed revisions are for our medical assistants to remain under clinical services, but noted that the supervision will still be through the health officer. Our resource liaisons are moving from our clinical side to public health preparedness to support our outreach effort and overall education and engagement. We also have on there a position of our project coordinator, which is a new position that hopefully we'll bring to the board sometime in the next board in September once we have secured that funding. These positions have already been approved in the current budget, and this request is for a small change to our organizational structure. Thank you.
Okay, thank you, Darren. Any questions of the board for Darren? If not, I will entertain a motion.
Justin Heath for the record. I move to approve the revised Central Nevada organizational chart, revising and allocating resource liaisons to public health preparedness and noting medical assistance supervision by the health officer per NAC.
Do we have a second?
Tyson McBride for the record. Second.
We have a second. All in favor?
Aye.
Aye.
None opposed, motion carries, and that change in the organizational chart has been approved. We'll go to item 11, the health officer update for August of 2023. Dr. McDonald.
Ted McDonald for the record. Good afternoon, Chairman and Board. It's a pleasure to be here. A little bit of a long presentation again, but I'll give the highlights. We have, as reported here, there is an uptick in the COVID-19 cases across the United States. I am provided daily a list of people in Mineral County and Churchill County who have been tested and tested positive for COVID-19. At this point, because our numbers are so small, it's not necessarily significant, but we have over the last couple weeks had increases in numbers of people tested positive for COVID. The good news is there's no increase in hospitalization. Across the United States, there's been approximately 4,700 people hospitalized, none in Churchill County. Compared to a year ago, there was 44,000, and compared to the peak in 21, I believe, there was over 100,000 hospital admissions. So there's an uptick, but again, they're just recommending pretty much what I put into my summary here is those people who are eligible for booster vaccines should get them, and good hygiene. Wash your hands, cover your mouth when you cough, all the basics that we were taught in kindergarten. Health alerts, this is mostly kind of giving you an idea of what I receive from the CDC. Some apply to this area, and some are just kind of unusual. Tick bite prevention is now a big thing in the Midwest and the West. There's something called the Lone Star tick, which can exist in Nevada. And when you are bit by the tick, it causes your body to produce a protein, which allows you to develop an allergy to meat. So, weird science. Right now, we are waiting for September for our vaccines. At this point, that's when we're expecting them. We will also be given recommendations on targeting for flu, and also there will be a big drive this year for the RSV. They're projecting that this year is going to be a triple, not an epidemic necessarily, but it's going to be endemic, that there's going to be that occur this fall. Right now we do have a program for what's called Bridge Access, and that is to allow us to provide vaccines to uninsured or underinsured. The commercialization of the vaccines now is may create a gap in vaccine availability, and also there will be approximately 40 million people across the United States that will be losing their access to free vaccines. Another thing that will play into my last part of the presentation is across the United States, another hazard that has been discussed is algae blooms. For the Central Nevada Health District, we now have a CLIA certificate printed and on the wall. So we've got that process out of the way. Veronica Brandenburg and Desi Reeves did an awesome job in preparation and making it easy. Our inspector was very helpful, provided us extra information and her contact so we can talk with her at any time that we have questions or need help. We're currently working on pharmacy certification. It's mostly at this point we understand the rules, and we're looking at making sure that we have the equipment to make our medications secure. Ms. Patterson, our nurse practitioner that will be coming on, is currently studying, getting ready to take her dispensing certification. She has to meet extra criteria, and she's going to be dispensing out of the office, and she is doing that. Our outreach program, I hope that you've had a chance to look at our calendar for what August looked like or is looking like. In September, we have lots of events where we've been reaching out to the community, providing vaccinations. We're still active in the senior center, providing vaccines. Tonight, there's a back-to-school event at the high school. or actually it'll be at the Rafter 3C. Our vaccination pod will be there between 4 and 6, providing pneumococcal vaccines for the seniors so they can go to school. This last Saturday, I had a chance to proctor students from the University of Nevada School of Medicine in our clinic. We saw 14 patients. We had to turn 7 away. We're there from 9 o'clock till 1 o'clock, so we did pretty well for 4 hours. We're set up for another 3 months. We also have a clinic that's in Lovelock. There had been some concern about attendance there, and I plan on getting together with Tyson McBride and talking with him about what we can do to increase numbers, and also the representative from the School of Medicine is willing to sit down and talk with us and help us with that process. We are also looking at our Medicaid and Medicare applications are currently in process. The final thing, thank goodness for you guys, is that I wanted to talk a little bit about the algae bloom. It was it wasn't a surprise to me, but we had phone calls regarding the algae bloom. And it is not necessarily, at this point it's well taken care of. The Forest Service and the Department of Wildlife have done a good job posting. But what it brought to mind was I didn't look and see anything until it was almost 10 days afterwards. It started on July 20th. The first notification came out through the state. It came out through the websites for the Forest Service and for a couple other entities. But I just thought that, well, this is an opportunity for us to set up a process where we first can address the things that we know are going to happen. Every year we have a bloom in Lawton almost. There is almost always mosquito warnings. There are, at the beginning of the irrigation season, talking about prevention of drownings. So we have a lot of things that we can predict and set up a canned process where we can schedule them to be dropped into our website as a presentation. There may be situations, though, where since we meet on a monthly basis and may in the future go to a quarterly basis, is a process where we know what's going to happen if we have to put something out there. And without having to ask the board's permission to put something in print or to put it on our website and to get it up and going. I think it's a reasonable thing to do. Our department is, from my perspective at this point, they're well educated, they use common sense, they ask questions. So if we could perhaps set up a situation where we know that if this happens, we have a policy and procedure. And the policy is in regards to what we can and can't do. The other part of it is that guidelines for what information we'll use, whether it's from the CDC, and also looking at notification to the board. So as we do that, giving the board a heads up that we are, going to be posting this, and that it would be on the next agenda for review and any discussion and ratification if you wish to do that. And right now, we're just looking to the board to see, okay, is this something that you would like us to pursue? Or is it something that's like, well, you would rather go a different direction?
Mr. Chairman, Jim Barbie for the record. I would just suggest that we could put in a policy, but wouldn't this be also the kind of the directive of the administrator? Whoever.
Yes, it would, but we wanted clarification to make sure that that would be the administrator's responsibility to go ahead and move forward with that. And that's why I'm feeling like it came up, there was questions. I think that's personally how it should go. The administrator, you know, that's part of their responsibilities to move forward with that and make that call. And then, would the board like to be notified when that happens, or wait till the next meeting? You know, and that would be part of the procedure sort of stuff. Is if that's policy will be that it's the administrator's job to do these releases on an emergent basis. And then the procedure would be, this is how you do it, this is where it's posted, this is who you report to immediately or in a certain time frame.
And that might look something like, I would assume on my part, again, Jim Barbie for the record, sorry, that this would be part of the job duties that would be identified for the administrator, and then at each of our meetings, there would be a summary of public and press communications. Or that would be my suggestion. If you're going to bring something back at the next meeting to be official policy, it may be just make sure it's included in our job description for that position.
Mr. Chair, can I make a comment? This is Shannon Ernst.
Sure, you bet.
So for the record, Shannon Ernst, Churchill County Social Services, and as part of the development for the board, there was an actual resolution created by and approved by the board for the administrator to develop the policies and then to provide those notifications of those new policies to the board, and then they could be pulled if there was questions. And so I would really urge for Dr. McDonald and all health staff to work with the administrator currently and in the future to develop that, so then that ratification would come forward before the board. So it's very clear in that process.
Okay, I think that's good. Both suggestions are good.
Okay, Ted McDonald for the record. I will discuss this with Caleb Cage and staff, and we will move forward with helping the administrator to develop that process. Thank you very much for your input.
Okay, thank you. Anything else for Dr. McDonald? If not, we'll go to the administrator's report. Do you have one for us, Darren? Okay, thank you.
I do. Thank you, Mr. Chairman, members of the board. For the record, Darren Winkleman. Yeah, we continue over the last month to implement our programs, and it seems like we're moving a mile a minute, which has been really great, and I think we've been successful at it. There are a lot of major highlights in terms of the community events. Dr. McDonald had mentioned some of them already. We've done one on July 29th, Churchill County Community Day. August 5th was our rural outreach in Fallon and Pershing. We have a couple coming up, I think you mentioned tonight. August 12th, 2 events, Mineral County's Back to School and Pershing County's Resource Fair. And then August 16th, we have a Back to School night in Pershing as well. So lots going on in our back to school events, trying to get kids ready to and immunized and back to school. We have mailed out our invite letters and applications for the Food Advisory Board. That went out this week. We got the website updated with that. We also had worked with our PI, the Churchill County PIO, to help with the social media. So hopefully, in fact, I think I got a first application yesterday. Shannon forwarded to me, so that's kind of exciting. And let's see, in personnel matters, we continue to hire. We have interviewed, a few things have changed since we, or for this report. We've interviewed for our environmental health specialist. He begins, will be on August 21st. And Sean, we look forward to having him on board. Seems like we'll have a great asset for the district. We have interviewed for our office specialist in Fallon, and she will also begin, Amber will begin on the 21st of August as well. We have registered nurse interviews scheduled for next week, August 15th, so we're hopeful we'll be able to find somebody out of that group. And we've also interviewed for our resource liaisons. We interviewed yesterday in Pershing County, and we are interviewing tomorrow in Mineral County for the resource liaison. So keep our fingers crossed again that we find some good candidates there. So we're excited about that. Dr. McDonald also mentioned that our nurse practitioner will begin this coming Monday, the 14th. Hopefully we'll be up and running with her in 1st of October, hopefully. She has a few things to get under her certifications underneath her, but we're excited that she's starting and we'll be able to enhance our services not only here, but in the Churchill and the Mineral and Pershing as well. Website development, we continue. That's an ongoing process. We work with Creative Canyon to help create that. As mentioned, we put our advisory board application on there. It looks real good, and the access to that is pretty easy, so we're excited about that. Funding continues to roll in. District funding remains, as of this report, is about $437,000. We also are looking for some funding to come from the Fund for a Healthy Nevada. They're going to split $1 million equally amongst the districts, so that's exciting for us, and I'm sure that will come forward as we learn more and develop that agreement along with Fund for the Healthy Nevada. We have children immunization grants, it's about $78,000, and then environmental health is starting to slowly roll in with some of the permit fees coming along with that. And then again, we will always continue to look for competitive grants and any grants that we can help implement the district. So with that, I'll entertain any questions.
Are there any questions for Darren? Thank you. We'll go to item, that was 12A. We'll go to item 13, consideration of future agenda items. Are there any items that any board member has? Go to item 14, consider schedule future meeting dates. What is that, second Thursday in September at 1:30?
Yeah, September 14th at 1:30, and this room is reserved if that's your desire.
So that's September 14th at 1:30. Thank you, Pam. We'll go to item 15. Public comments, once again, is general in nature, not relative to anything on the item of the agenda today.
Mr.
No
Chairman.
decision could be made. Jim?
Oh, sorry. Mr. Chairman, I'll take advantage of public comment real quick just to give a bit of an update. The county is closing escrow tomorrow on 270 South Main Street, which is was a former furniture store in downtown, which will have a basement, a main floor, and a upstairs area. It has been redone as an office building, and that will be the future home of both the Central Nevada Health District as well as the Churchill County Social Services. So that's very exciting, and we are continuing to work on the potential of getting a hold of the property immediately next door as well. So good things in the future for the health district, just as an update.
Thank you, appreciate that. Does anyone else have anything? If not, we'll go to item 16, which is adjournment. So we stand adjourned. Thank you, everyone, for attending today, and we'll talk soon.